I welcome you all. I hope you all and your families are doing well and staying safe. I welcome you all on behalf of Anikant Community Center, Jain Center of Southern California, Jaina and Sarvamangal Family Trust. And we will start with a Navkar mantra done by Kinna Gandhi Shah.
Namo Arihantanam, Namo Sitanam, Namo Ayaryanam, Namo Vachayanam, Namo Loe Savasahunam, Eso Panchanamukaro, Savapavapanasano, Mangalanum Cha Savvesim. Paramam Havai Mangalam.
Thank you. While all the attendees are going to be mute, and still we will respect if you don't go back and forth. We will have question and answers time. I got few emails with questions and I'll do my best, while I cannot promise that we can cover everyone's questions. We do intend to finish the presentation, hopefully whenever Dr. Manoj Jain says, but our goal is to be done with by 6, but we can run over time with questions, but definitely not with presentations, so that if you have your plans at 6 and need to go, you will definitely hear the expert before you go. But those who want to get some answers, we can hang around for a few minutes. And now, our speaker. For all those members who are from Jain community, certainly know him very well. I personally have known him for many years, and it took literally 2 minutes when I asked him whether he will be willing to do this talk for him to say yes. He's a clinical professor of infectious disease at University of Tennessee, Memphis, and many other hospitals and places. He is a visionary leader of Jain community and is involved in many activities, from education to spreading Jain principles to mentoring youth. He's also on a task force in Memphis for COVID-19. And without further ado, I will welcome Dr. Manoj Jain. And let me send you the screen, Manoj Bhai.
Great. Thank you, Nitin Bhai. I want to thank you, Manu Bhai. I want to thank Mahesh Bhai from Jaina and so many people. It is absolute delight to share with you some of my learnings and help answer many of the questions that you may have. Let me just ask, are you able to see my screen?
Remember, Manoj, most of them will not be able to say anything.
But yeah. Nitin Bhai, you're able to see my screen?
I can see it. Okay. Manu Bhai, can you see? All those who are on the phone can say thumbs up. I mean, on the webcam, you can say thumbs up.
So great. Thank you so much to Jaina and so many people who have joined. So I am an infectious disease doctor. So every day I go to the hospital and I see patients with a bacteria infection, a virus infection, fungus infection. In fact, in November and December, I was in India working with WHO, World Health Organization, on tuberculosis and how do we contain the multi-drug resistant TB. At that time, I had no idea what was going to transpire over the next 3 months. I don't think anyone did, but I'll tell you a story. It was about 10 years ago when the avian flu was there. And at that time, one of the hospital executives asked me this simple question: Dr. Jain, what keeps you up at night? We're in an infection control meeting. And what I told him is that if there is a virus which can be transmitted through a respiratory route, and it has a higher rate of infectivity than the flu, and it has a higher rate of mortality than the flu, that would really keep me up at night. I can say this, I haven't been sleeping very much, and there are real cause for concern, but there's also real hope and preventive measures that we can take. So I want to thank Jaina and everyone for giving me this opportunity to share some of this. I want to take about 20 minutes in the talk and then take a lot of time in answering questions and where we are. Okay, so first, what keeps me up at night is a virus which has a higher infectivity rate than the flu. It's better to compare everything to the flu because we know what the flu feels like physically. We know what it feels like in the epidemiological sense, in broader scope of the society and the community. So if you look at the flu infectivity, one person spreads it to another person. So this chart, what it does is it looks at the infectivity of various diseases. One person infects 16, measles, as you know, one of the most infectious diseases. You take another disease like HIV, one person infects 4 other people. You take the seasonal flu, one person infects 1 more. Well, how many people does the coronavirus, COVID-19 infect? And in fact, maybe 2 to 3, and now the new studies are showing 4, 5, 6 or more people. So 4 to 5 times more infectious than the flu. Well, what about the mortality? The question is hang on one second. How much more lethal is it? We know that SARS and Ebola were very lethal, 45%, 10%. The flu is not very lethal, maybe 1 in 1,000 or less. Where does COVID-19 stand? Somewhere around 5 to maybe 10 times more lethal mortality-wise than the flu. So those two things combined together, the infectivity and the mortality, is what makes the coronavirus, COVID-19, to be so concerning. If those two were different and reduced to where the flu is, you and I wouldn't be where we are today, and we would be living our lives in the old normal. But now we're in a new normal that we need to learn and how to do it. Another thing that we need to know is how viable.
Manoj bhai?
Yes.
Manoj bhai, sorry
Yes.
to interrupt you. This is Mike. Seems like I'm getting questions by some people that they are not able to hear. There is no audio, and that is
Okay.
so just.
Are you able to hear me?
Yes, I'm able to hear you, and I'm sure other people
I
have
can
been.
hear you very well, Mike. So I don't know what would you need to do, but I hear him well.
I'll speak a little louder if that may help.
There was no need.
Okay. All right, I'll continue. If then maybe we can ask them to, if you're not able to hear clearly, we'll possibly try to call in again, and the connection might be better.
Yeah. See. Okay. So everything is fine on our side, because some of the audience is saying that I'm fine now. I'm able to hear now.
Okay.
So I guess there were some issues on their end itself. So you can continue.
Okay. Sorry. So
Right.
what really concerns us also is the viability of the virus. What we find is that the virus can be in the air for up to 3 hours. So imagine that. Someone coughs, goes away, but you're still, that area can have the virus. It is on copper for 4 hours, but it can be on paper and cardboard for nearly a day. on stainless steel for 2 days, and then on plastic for 3 days. So that all is very problematic, along with the mortality and the infectivity. So now that lays the surface for the basic idea of why this virus concerns us. The other thing that we know is the mortality rate overall of other diseases and where that this could rank. If you look at the seasonal flu, maybe 40 to 60,000 people in America die from the seasonal flu. And yes, we deal with it year by year, but how many with the COVID virus are we going to die? We've already reached about 40 to 50,000 a number, and yet the epidemic is only in its early stages. We've done a number of estimates, and we could even reach 100 to 300,000 deaths just in America. You can imagine what things can be like in other countries, like even in India, and all the protection that we have to take. So that is why one needs to worry. Okay, I think it's really important to understand and take a minute and understand the timeline of how this disease works from a clinical sense. So suppose that you were in contact, or I was in contact with somebody who had coronavirus. So I went to the hospital today, and if by chance I wasn't wearing my protective gear and a patient infected me. So if I were exposed today, then about 5 days from now, I would begin to feel feverish, cough, shortness of breath, and I would be feeling tired. A couple of days later, I would decide, wait a second, I need to get tested. And then the test, by the time it comes back, and then it would take me another 5-7 days to recover. But here is the kicker. Here is what really is problematic, and it's this. You become contagious 2 days before you become symptomatic. So the 2 days before I had that cough, or before I had the shortness of breath or fever, I was transmitting it to my family members, to my colleagues, to my patients. And that is what's so worrisome. The contagiousness before the pre-symptomatic stage is what worries. So this is a common scenario. It happens for about 80% of the population. People feel better after that, and there's no problem. But here is when people get into the hospital setting. With what 20% may be symptomatic, and then a percentage of that will get admitted to the hospital. Again, if I were exposed today, 5 days later, I would begin to have some symptoms, and then 12 days later after the exposure, I would develop a syndrome which is similar to what we call ARDS, acute respiratory distress syndrome, and then I would become fairly ill, short of breath, and even on the ventilator. And this is how many people are getting admitted to the ICU and dying. There are a number of measures we can do to try to prevent this by treatment. However, the complications and the death rate still is very high. So I just want to help you understand, yes, there's a 80% chance that if you do get, and there are many people who may be on the a call right now who may have been infected with coronavirus. There will be many who may be at risk. And so just to let you know that this is the usual course. 80% do fairly well, but 20% have some complications. So there is a pyramid that develops in all of this. If you look at it, that if we test, now this is not those who are in the community, but the people who come in with a flu-like illness. If you 1,000 people come in to the hospital, to their doctor with a flu-like illness, or even if you have a flu-like illness, then out of those 1,000, 100 will become positive for the COVID virus. So 10% positivity if you begin to experience fever, cough, shortness of breath. Many of them may be simple things like a strep throat, maybe just a common cold, but 10% will be COVID-19. Of those 100 people who are positive, 15 will end up being hospitalized. That's an extremely high number. compared to the flu, where maybe one would have been hospitalized, there's 15% who get hospitalized. Of those who get hospitalized, half of them, out of 15, 7 will end up being in the ICU, and 3 will be on the ventilator, and 1 or 2 will not survive. And that is what concerns us most about coronavirus, is that it can cause tremendous amount of complications. So all of that information, if we had not done the level of social distancing, which I'll talk about a little bit, we would have needed in every city in America, much like New York, 2 times the hospital beds, 3 times the ventilators, 4 times the ICU beds. Can you imagine our hospitals having to do that? Impossible. But we have not seen this scenario play out in all the other cities like it has in New York for one and only one reason. And it's because we have done the lockdown. We have done social distancing. When we do what we call social distancing, what we effectively do is that we starve the virus. What starving the virus means is that we don't allow the virus to feed on our interactions. The way the virus grows and it goes to a larger population is through social interactions. Even simple 5-10 minute conversations with a person who's infected can cause that virus to come for you to be infected. So we starve the virus effectively by not doing social interactions or doing social distancing. So what that is doing, in effect, is dampening the curve. And what I mean by that is this. If we had done nothing or such as a lockdown, we would have seen this huge upsurge like we did in in Italy and in New York. We would have seen a upsurge. But by doing what we did, we flattened the curve tremendously, but we have delayed the rise, and we have sort of delayed the peak of the epidemic. But we have significantly dampened the curve. That's what they've talked about, flattening the curve. Now, for a long time, we thought that was all theory. We said, oh, you know, that's great theory. That's great to know about those things. However, in 1918, this very thing happened between 2 cities, Philadelphia and St. Louis. What happened in Philadelphia was the first case was on September 17th. The mayor waited over 2.5 weeks to do the shutdown of the cities, doing the social intervention, and still it caused a huge epidemic to occur. St. Louis, within 2 days, put a clamp down, and what you saw was the curve was dampened. But what you also saw was a second wave. And you see a second wave, especially if you have flattened the curve, because there is a large percentage of the population who is still susceptible to the virus. And we'll talk a little bit about that. But what we're able to see in this graphic is very clear, that one way we're able to, yes, protect a lot of people and flatten the curve if you do the social distancing. Now, how do you measure social distancing? There's a website called unicast.com. You can put in your county and it gives you a grade and tells you by cell phone data how much social distancing is going on. There's also an app, mcontain.org, with our group in Memphis. We have developed this, which looks at crowding alert and encounter alerts. But the success of all of this has been by the first part of our journey to contain COVID-19 has been social distancing. So let me go into a little bit of depth on what this really means and why you need to be thinking on unique and innovative ways of, in your life, in this new normal, how we will be able to do social distancing and not allow the virus to feed on our social interactions and infect one another. If you're home alone, you have no proximity encounters. You have no way of spreading the virus to others or others to you. In a family, you have a family of 4, there are 3 encounters. So that's a little more at higher risk of transmitting. At work, maybe 10 encounters. But when we begin to go to a temple or in places where people congregate, you can have as many as 25 or more encounters in terms of spreading the virus. But then it gets really concerning when you have large gatherings. So I'll tell you a story. I live in Memphis. South of us is New Orleans. And when we began to see some cases in Memphis, we wondered how the cases had come here. When we started to talk to the patients, what they told us was that they were at Mardi Gras, which happens in New Orleans at the end of February. In the 2 weeks after that, middle of March, we began to see these cases come into the hospital, into the ICU. And all of the initial cases were due to this event where there was tremendous spread. And you know what happened to New Orleans, and we saw the huge number of cases. So the social distancing is a great measure to contain the virus, and it's an important measure that we need to use when we are not able to contain it by other measures. And it's the most significant impact that it can have. So as I finish up, what I want to do is to talk about, yes, we see that this is a virus which has lots of problems. And you can say, yes, I see that how it can infect people. And yes, I see what are all of the reasons why it has spread further. What is the end game? How will this virus be something which will go away or be contained? And how can we get back to at least not the old normal, but a new normal that is better than where we are now? And here, what we want to talk about is, yes, the social distancing, which was a blunt tool. And for months, we are now going to the 2nd month, we have contained it or at least reduced that impact. What we have to go to now that from that blunt approach to a more surgical approach. That surgical approach means that, yes, we begin to lift and open the country so that people can interact, but interact where we are more cautious in reducing social interactions, but also surgical approach of testing and more testing so that we can find out who's infected, then contact tracing. So we take those who are infected and find who their contacts are, and then isolating them, and also doing surveillance in nursing homes and other places where it's high risk. And certainly finding a vaccine at the end of this is going to be the game changer. And so I use this graphic to help better understand. So imagine the coronavirus is something which is invading into our society. What are the barriers that we can contain? Certainly hand washing. So I'll say this, it's really important to understand the concept of hand washing and its importance. And especially from our Indian culture, we know how important hand washing is. And also, I mean, I'll say it in Hindi, जब हमारी माँ थी वो बोलती थी कि सब कुछ वो छू कर रखना दूर और कुछ गंदा छूना नहीं और हर दफे हाथ धोना. And that was a very big thing in India, and here as well. We need to know that level of washing hands is incredibly important. And we know from studies, if you wash your hands 10 times a day, that your chance of getting a viral respiratory infection is reduced by 50 to 60%. Now just think, just a simple act of washing hands can make a huge difference. Masks are also protective. And then we've already talked about this social distancing and how it can prevent from getting the virus to other people. That was our first phase that we worked on to try to limit the spread of the virus. We're now approaching the second phase. And in this second phase, the surgical phase is testing, talked about isolation, contact tracing, and surveillance. This is where we need to be focusing on. And then lastly, we have to be talking about a treatment or an antiviral treatment or a vaccine. And that's going to take months, if not years down the line. So this is the core element we need to understand on how to contain and what we can do as a personal initiative such as hand hygiene and masks and social distancing to stay away. This is not something that the COVID virus, I would take lightly. I see many patients in the hospital with this disease, and it can be a very, very devastating illness, even for the young and middle-aged folks, and certainly you know about the elderly. And then the question often comes, if you're in any part of the country, is how are we going to open up? Well, here's what I have been sharing with the mayors, and I'm also on the state task force on when we open up our economy. And the conversation in the big cities we have is, when are we going to open what sector? The last to open are going to be festivals, conferences, concerts. Why? Because one person can infect 50, 60 people, and it's very easy. With the prevalence of the virus in the population, it varies from place to place. The studies from New York City came today, which was eye-opening, that nearly 20% or 1 in 5 people have been infected. Yes, they have been infected in the past, and likely they were spreading one to the other. They're now cured or have an immune system that they're not, that's protecting them. But at one time they had an infection, they may have been spreading it as well. And so we want to avoid large settings and large conferences or concerts. And we know that, yes, there's an economic gain from there as well. So balancing the risks, the economic gain, as well as the social and spiritual needs of the people. So let's take going to the temple, going to school. There is a higher risk than usual in that population. Why? Because we meet, we convene, we get together. But there's also a greater spiritual need as well. Going to the mall, again, a little bit less of a risk, as corporate offices and healthcare, so forth, are somewhat protected. And so what I want to finish with is this. We have a situation where we are seeing something that we were never seen before. It's unprecedented. And then we have to use this opportunity that we take what we have learned, both in science and also what we have learned in our culture and in our practice, and then take those into our day-to-day lives in a methodical way. Not let the panic overwhelm us, not let the concern be so great that we cannot act accordingly. But at the other end, let us not be cavalier about this also. So Nitin Bhai, I'll stop with that, and let's take some questions and comments, and happy to engage in conversation.
Thank you very much, Manoj Bhai. This is, the simplest way of COVID-19 that I've ever heard since the whole thing started. So really appreciate it, and I am sure 253 families had joined so far, and I'm sure they will appreciate what you have told us. We will also have at least 2 presidents talking in between, but my next plan is that first we will do 3-4 questions, and then I will invite Mahesh Bhai Wadar, President of Anagan Community Center, and Jaina, and then we'll do 3 4 more questions, and then in the end I will invite President of Jain Center of Southern California, Dr. Jayasbhai Shah. Question number 1.
Yes.
Kokila Mehta email asking that is coronavirus living or dead?
So good question. All right. So yeah.
And also, how does it multiply on surfaces, plants, animals? So you can cover both together.
Sure. So let's, and I'll do a little bit. So Jain philosophy, we're a group of folks who are from the Jain background. We understand the Indian culture background and as well as the Jain background. तो क्या वायरस जीव है या अजीब है? वो एक तरह से वो पूछ रहे हो. आप दूसरा क्वेश्चन पूछ रहे हो कि क्या वायरस in scientific terms, how and what it does. So let me first explain the science, and then I'll let you decide where you want to put it in the Jeev and the Ajeev category. So how does a virus work? It's really important. It's fundamentally different from a bacteria. You see, a bacteria is a unit of one cell which can multiply by itself. So if I take a bacteria, put it on a petri dish, just even one bacteria, it will replicate, double, then it'll go to 2, 4, 8, 16, exponentially, right? So that's how bacteria work. They are able to grow on their own. Viruses are very different. Viruses are RNAs or DNA, and coronavirus is an RNA, just a string of particles, but they are encapsulated. And this is what we call encapsulated. And it has, the coronavirus has these distinct proteins. But if I put a coronavirus on a surface or even on a petri dish, it cannot do anything. It cannot replicate. It has no ability to replicate on its own. The only way it can replicate is if there is a cell. And in our case, it finds a cell in our body, maybe in our pharynx, and especially in our lungs, and then it replicates using the machinery of the cell. So in a way, it's not able to live on its own. It becomes a host and attacks that cell within our body, and then it multiplies. Now, क्या जीव है या अजीब है, ये आपको बताना पड़ेगा. ये कोई साइंस नहीं बताएगी, और अपने शास्त्र में भी आप देखिए क्या लिखा हुआ है, and you have to interpret and figure that out. So that is there. Now, on surfaces, it cannot replicate on its own. On surfaces, what we know is it's on a droplet. A droplet allows it to be somewhat secured, and it does not replicate, but then it is still infectious because you touch that droplet, you touch your face, and then it can infect you. And like I said, it can be in aerosolized for about 3 weeks, and it can stay on surfaces such as plastics for 3 days.
Thank you, Manoj Bhai. Our host, Manu Bhai Shah, has an interesting question, at least to me, from my perspective. Why advanced countries like USA has highest cases, most death, and yet only 2% of testing?
So I'll talk about the testing. There's no question, we know very well that we failed in preparing our nation for testing. Many reasons, one of which was that the CDC did not engage the private sector early enough, and that's been a problem that has been corrected. So yes, what we have seen is that the testing has lagged. And Nitin Bhai, what was the other part of the question?
Most deaths here,
Yes.
And highest number of cases.
So in terms of the number of deaths, we still don't understand what is the exact number of deaths and why there's tremendous variation between China, Italy, US, and even in US different areas. But I can say this, a lot of it has to do with the following fact, that the deaths in COVID-19, in coronavirus, are largely due to an immune reaction. It's not the virus which is killing you. But you see, if you remember the initial slide, it's that 2 weeks later, when then there is this ARDS-like syndrome, and it's actually an immune reaction. And the treatment that we're doing for that is steroids or biologics, interleukin-6 blocker, that all of these treatments that we are doing are immune therapies which are seem to be working. So the deaths are more likely due to some type of an immune phenomena, and the immune system in various countries may vary tremendously, and we still don't know the exact reason, but that is likely what is going to explain the variation in the deaths. And the number of cases in a given population, we are not sure what is the number until we do more studies. And actually, in Western countries, in US and others, we have begun to do a lot of the studies that were not initially done in China.
Great, thank you very much. His other question is loaded, and before we go there, let me invite President of Anekant Community Center and President of Jaina, Mahesh Vada, to say a few words. And then for the audience, if you have questions, please text me or send a chat, and we will try and cover. Mahesh Bhai? Mahesh Bhai? Okay, while he comes.
He's still on mute. Yeah.
He said unmuted. Hey, Mike? Mike? All right, we'll get to the next question.
He is self-muted. Now,
Okay,
Mahesh Bhai is on
he's
now.
on. Go ahead, Mahesh Bhai.
Can you hear me?
Yes, Mahesh Bhai, go ahead.
Okay. So, Pranam and Jai Jinendra to all. Thank you, Nitin Bhai. This is Mahesh Vadar, President of Jaina. Jaina thanks everyone attending this important webinar on the understanding and containment of this terrible disease that has created all the deaths and sufferings globally. Jaina sincerely is very thankful to Dr. Manoj Jain, one of our own, to have taken time out of his busy schedule to educate us on this dangerous virus. Jaina would like to thank Dr. Nitin Bhai Shah and all the organizers, especially Manu Bhai and Rika Ben Shah, who are instrumental in managing the technology and bringing this event to our community. Please stay tuned. We will be bringing many more important topics to benefit all. Let us pray to Jineshwar Paramatma for peace and well-being of all lives on this planet. Please take care, stay home, and be safe. Thank you. Jainam Jaiti Shasanam. Thank you.
Thank you very much, Manoj, Mahesh Bhai. Let me get you some simple questions that I think everybody will like to know about day-to-day things before I get the loaded question.
Okay.
Bharat Maniyar asked me, and I'm going to give you all things together.
Sure.
How to clean groceries? Is there a value of the drinking hot water, doing the NAS with the Vicks VapoRub, and the role of antibiotic and malarial drugs?
Sure. So let's take, and if I try to remember all of them, I'll try.
Sure,
but
I'll remind you, no worries.
Yeah, okay. So let's talk about groceries. And let's even step a little bit back and what we do in shopping and other grocery things and so forth. And let's talk about it in the science that you have heard. Basically, you have heard all that there is known about the science of coronavirus in those ways. So for groceries, the question is, could there be a risk of surfaces being infected if someone else touches those surfaces? And the answer is yes. So when you are shopping And now this is especially important for those who are elderly, so over 60 also, and those who have underlying conditions such as heart disease, immune disorders. If you have some type of either kidney disease, diabetes, all of those things put together affect your immune system and can give you complications. In those cases, yes, it's important to take all the precautions. One is the mask, where you're in your public situations. The other is either you can wash your hands, you can wear gloves, but washing hands 10 times a day is what's important, and also not to touch your face. So when you do get groceries to take, and make sure that they are, you come at home, you wash them, and so forth. Nitin Bhai, what was the other 2, 3?
The role of antibiotics and anti-malaria drugs.
Yes. So there is no role for antibiotics in management of COVID infection. And the reason is because it's a virus, not a bacteria. However, if you get admitted to the hospital, what will happen is we will not know whether you have a bacteria infection or a virus infection. Like I said, 10% of people who come in with a flu-like illness will be a COVID virus infection, but 90% may be a bacteria infection, pneumonia, or other infections. For them, an antibiotic may be helpful. So the doctor will likely put you antibiotic. Now, we have heard a lot about anti-malarial, which is hydroxychloroquine. And the right answer, we don't know if it is or not helpful. Recently, 2 trials have been done, and they did not show tremendous benefit, or if any benefit. One showed that it was caused more complications. But why did this whole conversation begin? Why did we begin to use hydroxychloroquine or Plaquenil, the malaria drug? And it had to do with the very fact that on Petri dishes, in what we call in vitro, we saw this medicine be able to attack the virus in its replication, that it stopped one of the pathways in the replication of the virus. And that's why we used it. Is it clinically beneficial? We don't know. But I'll tell you this, if someone comes in and is fairly ill, we are still giving it, keeping in mind all the complications and monitoring their heart and everything for any complications as well. So we are watching that very closely.
Great, thank you very much, Manubhai. The loaded question now is any relationship between veganism, vegetarianism, why large meat processed plants have higher incidences, etc. This is from our host, Manubhai.
Yeah, so Manubhai, I don't know if there's a relationship in any of those, but I will say there are correlations, and there are real reasons for correlations between the meat packing plants and the virus spreading. And it has to do with people being in quite unhygienic conditions. And that is the same true with the wet markets in China. When you have an unhygienic condition, it is a prime place for the virus to spread. And that's why we see some of that. When you are in open spaces, and again, farmlands, distant places that people are far away from one another, then the chance of the virus spreading is much less. In terms of, I think you had asked about diet and hydration. So in fact, I would say hydration is very important. One of the things that this virus does is that it feeds off of our immune system. And what is very important is to keep ourselves hydrated, rested. So sleep is really important because our immune system works well when you have had good 7 or more hours of sleep. And then obviously diet, a healthy, nutritious diet we know is important. Obviously, we know that a vegetarian and a vegan diet are much better than any type of a meat-based diet. So doing all of those things along with अपन जैसे भक्ति करते हैं, अपन जैसे प्रेयर करते हैं, ध्यान करते हैं, मेडिटेशन करते हैं, ये सब चीज़ों से अपना क्या होता है कि जो स्ट्रेस होता है वो लोअर हो जाता है and you are able to have your immune system be able to fight the virus in stronger ways. And that's is the most critical defense system that we have.
Thank you very much, Manoj Bhai. What do you think about the TB vaccination that the third world countries or Eastern countries have? And is there a relationship to reduce the incidence?
Yeah. So I'm hoping that is a real potential cause of prevention. There are clinical trials being done as we speak, and that might explain why it might be more contained in China compared to Western countries where we don't vaccinate, and in India. I mean, many of you are aware that Modi ji has put on just a tremendous lockdown. I have been talking to the principal secretaries in Madhya Pradesh, the collectors, and others, the people that we have worked with in tuberculosis, and who are now working for coronavirus. They're doing all the right things in containing it. The key is going to be then subsequently, how are we going to be able to test, isolate, contact trace, do surveillance? That will be a challenge in a country like India. But there might be hope for that there could be some level of prevention because of the BCG vaccine. And then there's hope that there might be a treatment and there might be a chance of a vaccine. I'll just say this in terms of another treatment that's showing promise is immune globulin, or what we call plasma therapy. So we get antibodies from those who have had COVID-19 infection. We give those early on to those who are coming in with a terrible infection. We've treated a couple of patients with that and had a fairly good response. And so we think that could be there. I wanted to just mention one thing on the testing also. I think it's really confusing for a lot of people on what test and what does it mean. And this is the way to sort of think about this. There are really two types of tests that are being done. The first is the PCR test. And that's the swab that's put in the back of your throat, and that looks at the virus particles. That tells us if there is a current infection. So the PCR, the swab test, tells you if there's a current infection. The other test is the blood test, which in fact, I got done today, and it looks for antibodies. And that test, the antibody test, tells us if we have had a past infection. Looks at IgG antibody for those of you who are in medicine. There are other tests that look at IgM, but it really looks at the IgG. And if that is positive, that means you have had a past infection. So all of us very soon, within the next 2 to 3 weeks or a month, will classify ourselves into one of these three categories. Are we COVID positive, meaning we have a COVID infection? Are we COVID immune? That means that we have had the infection and we have recovered and have antibodies. Or are we COVID susceptible? That means we don't have the antibodies and that we could become infected. So those are the three ways that we will be categorizing ourselves using the two tests. The one test is the PCR test, and the other, which is the blood serology test.
Thank you very much, Manoj Bhai. If Dr. Jayesh Bhai Shah, I'm asking Manoj Bhai one more question, and after that, if you can come on and say a few words. This is a very common question in terms of how long social distancing. My wife is asking me this question. I don't have an answer. And also all other aspects of prevention, how long, etc., should be continued. Thank you.
So very good question. You see, social distancing was just a temporizing measure. I think it's really important to understand. Social distancing was a temporizing measure that gave us time to build capacity to be able to do the testing, the isolation, the contact tracing. It is something that gave us time. If we had not done social distancing, every city in America would be going through what Italy and New York went through. So it's a temporizing measure. It has bought us time for us to then begin the surgical approach of contact tracing and so forth. And also it has taught us as a society on how we need to protect ourselves with washing hands, with the mask, and then keeping our distance. Going to a restaurant will be very different. The new normal, going to a restaurant will be people staying far away. Waiters will be wearing a mask. And we will not be convening in temples or churches or other places like we usually do in large numbers. I don't see that happening for quite some time, even 6 months to a year.
Wow.
Yeah, very different. Until you get a vaccine and you have a susceptible population, we will have to be thinking about going to the temple with times when people are not there and people wearing masks and people coming in at different times, not shaking hands, not hugging, conversations standing 6 feet away. Very different world, very different world.
As the temperature rises like flu, wouldn't it kind of slow down or go away?
We're hoping that that can be the case. However, we have no clear evidence of that. We still saw cases, significant number in Australia when they had their summer. But here's the thing, the cases may temper or stabilize. However, when the flu season comes, and this is what the CDC has said as well, when you have flu again mixed in with COVID-19, because it's not likely to go away by then. If even 10 to 20% of the population is infected now, to get herd immunity, you need 60 to 70%. So going from, say, a place like New York, they have 20%. New York City has 20% who have been infected. LA, I believe, had 4% who have infected. To get to herd immunity, you need 60 to 70%. And that's going to be very difficult. And you can imagine the complications and all that will be there. So the fall season will be a very trying time for us.
Great. Dr. Jayesbhai, President of Jain Center of Southern California, please say a few words.
Jai Jinendra to all. Manoj Bhai, nice to see you.
Nice to see you.
I want to thank on behalf of Jain Center of Southern California and on behalf of all the attendees, those who are here listening to your lecture, for such a wonderful explanation about COVID-19. We have been getting so much information on TV, news media, magazines, and even WhatsApp. Yeah, we are getting bombarded with WhatsApp. But to hear in such a simplified form and for average person to understand, this was excellent presentation. So thank you very much. By doing this, what your expert advice and wisdom has helped everybody. It has helped to understand how coronavirus affects us, how to prevent it, how to treat it, and how to stay healthy, which is the most important part. On top of that, many people have a lot of anxiety. People are going through anxious moments where I see in my practice, many people say, I feel like I don't want to live anymore, or they're so anxious and getting depressed. Those are the one you have calmed their anxiety, and you have cleared many of the myths which people have in your question answer. So I'm very thankful to you for taking this time and explaining this. Plus, I would like to thank Sarvamangal Family Trust, Manubai and Rikaben, for taking this initiative and helping us out. It was very good way to do it. Thanks to Nitin Bhai and Mahesh Bhai, and this would go a long way. So I do thank you, and I want to say last word that please stay safe and healthy to all those attendees who are on the program. Thank you very much. Jai Jinendra. Bye.
Thank you, Jayesh Bhai. To all the attendees, thanks to Sarvamangal Family Trust, we started with go-to meeting, and then we moved to Zoom, and finally it seems that we have found a good media where we had at one point 255 families, and still we all could listen to Dr. Manoj Jain very quietly and peacefully. Wonderful. I have one or two last questions, Manoj Bhai.
Sure, Nitin Bhai. Yeah.
Best course for action for a patient whose status was lung transplant and insulin-dependent diabetes. Should I just say, don't go out of home for 1 year?
You know, I would say that they really need to stay in a home setting where they really minimize their interactions for the next 2 to 3 months. Let things figure out. There's no hurry to be going out, and especially in places like New York City, places where there is a spread of virus. This can have devastating effects on people who are otherwise living their normal lives in the old normal. I mean, but this is not the time to be cavalier, especially if you have immune problems. We can do so many things virtually, and we never realize the power. I'm on about 10, 12 conference calls a day, and I'm able to accomplish a lot, as you all have learned and we have learned. Let's give this time. Let's figure out. I think patience is what is really going to be helpful. And as we've talked about, anxiety is going to be one of the things that is going to affect us. But we can use our religion and faith to allay that anxiety, to understand कि लाइफ में कई बार ऐसा होता है कि ऐसी तकलीफें आती है. We don't know, अपने कर्म के कारण है या और कोई के कर्म के कारण है, या whatever it is, the situation. But how we react to it is so critically important. And for those who are feeling very frustrated, and then also for those, many of you who may have lost a job or are at the threat of feeling that you may lose your job, the community is there to help. That is what we are there to do. And education, information is helpful, but then please make a sense of community with other people around you as well.
Great. I have a last question, and then I will see if Manubai wants to. People are asking simple question about, should we all drink warm water? Should we do the vapors from there?
Sure. Yeah.
Yeah.
So
Good.
Yeah. So I'll add. So hydration is very important for any illness and so forth. Yes, warm water, it's good, soothes the throat. I cannot speak from the scientific perspective because we don't have a clinical trial to help us. But to give that sense, some people just say haldi use karte hain. That's perfectly fine. There's no harm in doing things that you already do that will boost your immune system. However, do not substitute that with good social distancing, hand hygiene, wearing a mask, all of the preventive measures, and certainly going to the hospital or talking to your doctor on the phone and getting the right medical advice. दोनों चीज करने में कोई प्रॉब्लम नहीं है. We can जो अपना धर्म कहता है, जो अपना सिद्धांत कहता है, वो करो, और साथ साथ जो science बताती है वो भी करो. That they are completely compatible, in my opinion, and that's the beauty of our religion compared to, you know, maybe other traditions and other faiths. That they may not be so collaborative. Our faith is very collaborative with science. It is very scientific and logical thinking in that way. So I would really encourage people to use it in collaboration and synergy with science and religion and faith.
Thank you very much, Manoj Bhai, and thank you all the attendees. Actually, I got to cover everything that I got. So in the future, when we do this, try and send me more questions. And I will request Manoj Bhai for the last word.
Thank you, Manoj Bhai, Nitin Bhai, and everybody. This is all it means. We are technologically there, and we got to do this more often. And our offer will stand to Jaina, Jain Center, and everybody else. My wife is here too. To whenever you need technical help, to go to webinar, which up to 1,000 people will be able to accommodate 1,000 attendees. So we are ready for that, and anybody needs for all kind of things about related to not just Covina, but anything to make our life easier during this tough time. Don't hesitate to contact me or Nitin Bhai or Mahesh Bhai, and we will get to us. Thank you.
All right. Thank you very much. You are a
Okay.
wonderful audience. 225 minutes. Please stick around.
Yes.
Thank you,
Stay
Manoj Bhai.
safe.
Jai
Stay
Jinendra.
safe. Jai Jinendra.
Thank you, Jai Jinendra.
Thank you all.
Ben, nice to see you. Thank you.
Thanks, Jayesh bhai.
Thank you.
It's Jai Jinendra, Jayesh Bhai, Jai Nitin Bhai, Jai Jinesh Manu Bhai. Thank you.